Oh, yes, sir, we are live. I'm sharing the link.
Okay, ma'am. I'll share the link also everywhere and then I'll start.
Yeah.
Hello, good morning, everyone. Is my voice audible to everyone? Please put a message in the comment section. Thank you. Today is a beautiful day. Hello, Sunil. Hello, Sushma. Hello, Himanshu. Hello, good morning, everyone. Hello, Sheetal, Vishakha, Anuradha, Ajit, Jyoti, Neha, Sneha, Anupam, Kaushik, Sonam. Is my voice audible? Yes, Sheetal. Okay, great. So we're gonna start the class within 2 minutes or 1 minute. We're gonna start the class. The today's topic of choice will be our kangaroo mother care. Okay, I hope my slide is visible and I hope my voice and my face is visible. Okay. So today is a beautiful day. We're going to talk about kangaroo mother care, a very simple but yet very important topic which has come in exams multiple times. We're going to cover the theory as well as the MCQs also pertaining to kangaroo mother care. Okay, it's a simple topic, very nice topic, a healthy topic for a morning to start, which will which will not make you sleep, which will enlighten you a little bit. So that's it. We're going to start now. Yes, great. Hi Jyoti, hello Tanuja, hello Siddhi, hello Priya, Nayak, hello Bhagyalakshmi. And yes, we're gonna start now. And I'll be asking you questions in between. If possible, try your best to answer. The more you participate, the more it'll be nice, for you, and you can get very well marks in exams. Okay, so let's start. Hmm. I'll just check. Yes, my pen is working. Okay. So most importantly, hello everyone. Welcome to Pediatrics by Dr. Anand. After a long time, I have gone live again, where I'll be talking about our topic, kangaroo mother care. In English, we say kangaroo mother care. Okay, it's an important 5 marks question for theory, and it has some 7 to 8 MCQs, which is important for us. Okay, this session will be exactly for 30 minutes, 30 to 40 minutes. This session will be spoken in Hindi and English language. Anyone has any doubt, put a message in the comment section. I'll be checking back to back the live session also, and I'll what do you call it, enlighten you with the thing. Okay, so yeah, so most importantly, before starting any lecture, we always have a beautiful motivating quote. And today's motivating quote says that whatever you decide, make sure it keeps you happy. Whatever you decide, make sure it keeps you happy. Whatever you're studying, whatever you're doing in your life, whatever you're doing, make sure you're happy. So much hard work in life you're only doing to have a wonderful future and to be happy, right? So some many of us have this tendency, we while working hard, while studying for exams, we are so agitated, we are so irritated, like कभी कभी ऐसा होता है एग्जाम्स के दौरान इतने चिड़चिड़े हो जाते हैं, इतने इरिटेटेड हो जाते हैं, इतना सारा पढ़ना होता है और वी स्टॉप एंजॉइंग, हम एंजॉय करना लाइफ को बंद कर देते हैं और बस टेंशन 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 में रहते हैं. सो फॉर ऑल दोस्त हु आर इन द सेम बोट, सारे स्टूडेंट्स जो ये सोचते हैं, तो मैं यही कहूंगा कि पढ़ो, अच्छे से पढ़िए, बहुत मस्त पढ़िए, लेकिन मेक श्योर यू आर हैप्पी ऑल्सो बिकॉज हैप्पीनेस इज द की. Okay, happiness is the key. Okay, so we'll start now the session. This one, yeah, kangaroo mother care. Point number one of kangaroo mother care, what do you called, the first picture which comes to the slide. Could you comment on this picture? Can anyone comment on this picture which is seen in the slide which I have shown? It's a picture of kangaroo mother care. Like what exactly the mother is doing over here? Any random guesses? Yes, very good, very good. So point number one, like in kangaroo mother care, why are we doing it kangaroo mother care? What is the importance of doing this? So point number one, kangaroo mother care is basically done for all low birth weight babies. It is done for all the low birth weight babies. Can anyone tell me what is a low birth weight? Anyone who is in live sessions, can anyone tell me what is low birth weight and what is very low birth weight? Is my slide visible? I think yeah, it is very well visible. Yes, very good. Very good. So yes, low birth weight of any baby who is less than 2.5 kg. Any baby who is less than 2.5 kg is a low birth weight. Okay, so means point number one, what are we trying to understand here? We are trying to understand that in kangaroo mother care, like most importantly, we are giving care to the low birth weight baby. Low birth weight is someone who is less than 2,500 grams or less than 2.5 kg. Very good, Sharon. Very good, Sheetal, Suman, Sucheta, Linda, and Sonali. Very right. These are the ones we do for the what you call low birth weight care. Okay, I'll just share my, slide again if you're not able to see it. One second. Yeah, I think everyone is able to see the slide. Yeah, perfect. So after one, the point number one for kangaroo mother care, number one, it is a method of care for the preterms and low birth weight. That is the first point. Okay. Second important point, what are we doing in this kangaroo mother care? We are having the skin to skin contact. I am putting the baby on the mother's chest, skin to skin contact. Okay, number one. Number two, of course, with skin to skin contact, I'm also doing exclusive breastfeeding. I'm also helping the child for the exclusive breastfeeding. Are you understanding? So what are we doing? Again, no cramming. Try to understand the concept. We are studying kangaroo mother care. In kangaroo mother care, point number one, we are giving care to the preterms. Okay, to the preterms and to the low birth weight baby. Low birth weight is less than 2.5 kg and preterm is less than 37 weeks of life. है ना? Very good. Yes, Himanshu is right. Pooja is also right. Vishal also is very right. Okay. And next important point for all this, like what is the benefit? Like one of the important benefits of kangaroo mother care is nothing but early discharge of the baby. Naturally, the more the baby will be there on the mother's abdomen, the more the baby will breastfeed nicely, and the more chances of this baby is there, to for the early discharge. Early discharge. So, exam question number one, they always ask you that kangaroo mother care is done for which all babies? All the babies who are low birth weight, all the babies who are pretermer, they are the ideal candidates for the kangaroo mother care. In Hindi, we say kangaroo. In English, we say kangaroo mother care. Are you understanding? I hope you are able to understand. Very good, Anusha. Yes, Ames Bhopal. Very good, Siddhi, Vishal, and Pooja. Very good. Perfect. Okay. What are the other benefits? So I'll give you 10 seconds to think if you can put a message in the comment section. What are the other benefits of doing kangaroo mother care? One thing we learned that early discharge will be there for those babies, which I understand. Any other what do you call this one benefits? Yes, very good, very good. Anusha is answering wonderfully. Hello, Ruchika. Good morning. Good morning. So the most first important benefit we have done, it improves the breastfeeding. It improves the breastfeeding. Yes or no? Number one, it improves the breastfeeding of the mother at discharge. Number two, it reduces the risk of mortality. Yes or no? I hope there is nothing to cram in this. It is very simple. The जितना ज़्यादा मदर अपने बच्चे को अपने पास रखेंगी, स्किन टू स्किन कांटेक्ट करेंगी, उतना बच्चा जल्दी डिस्चार्ज होगा, उतना बच्चे के मोर्टेलिटी कम होंगे, उतना बच्चे को सेप्सिस कम होगा और उतना बच्चे का हॉस्पिटल स्टे कम होगा और उतना बच्चे को हाइपोथर्मिया मतलब कहते हैं ना बच्चा ठंडा पड़ गया, हाइपोथर्मिया हो गया, कोल्ड हो गया, उतना बच्चे को हाइपोथर्मिया कम होगा. These are the very important benefits. It's a 5 marks and 3 marks question for theory, and as well as some 5 to 7 MCQs are there in this topic. It's a very simple, cute, happy topic which will not make you sleep. Okay. Very good. Jyoti is right. Roshan is right. Vishal, Shilpi, Sharon, Siddhi, Suman. Yes, very good. Perfect. तो ये सब क्या है? ये सब क्या है हमारे पास? Benefits हैं. These all are the benefits of doing the what do you call kangaroo mother care. So I'll repeat again. Number one, there is early discharge. There is what you called reduced risk of mortality, reduce sepsis. Reduce what you called length in hospital stay and prevents hypothermia. So I will give you a toffee. I'll give you a toffee. Anyone, if someone can tell me what is the ideal temperature of labor room? Any idea what is the ideal temperature of labor room? Any random guesses? I'll be asking you random questions. Okay. Ideal temperature of labor room. Can anyone tell me what is the ideal temperature of labor room? Any random guesses? Okay, we have so many people are answering. Swati, Alina, Pratibha, Pushpa, Dipali. Okay, within 5 minutes we have crossing 100 students. Okay, Suman says 24 degrees Celsius. Okay, anyone? Jodha says 22. Sheetal says 22 to 26. Mahendra, Simran. Okay, and Anusha. Yeah. So the best answer, yes, you're right. Only 25 to 28 degrees Celsius. Okay, 25 being the best answer. The ideal temperature of labor room and even the ideal temperature of our NICU. Okay, the ideal temperature of labor room and ideal temperature of our NICU is usually 25 degrees Celsius and what you called you can say that 25 to 28 degrees Celsius. Some book says 25, some book says 28. and 25 to 28 degrees Celsius is the ideal temperature of the labor room or even of the NIC also. Very right. So Anusha is right, Dipali is right, Pratibha, Ames, Munni, Himanshu, and Sushank. Yes, perfect. You all are amazing. Okay, next let's finish it nicely. Let's finish it fast. What are the components? What are the components of kangaroo mother care? Can anyone tell me what are the components of kangaroo mother care? Any if this comes as a 3 marks question, what will you write it? Yesterday only we in our nursery our one of our very amazing doctor, Dr. Nidhi, she's DM neonatology. She was asking me the same question that Anand, what are the components of kangaroo mother care? So in kangaroo mother care, the point number one, which you guys see in the photo itself, we'll do kangaroo position. कैंगरू पोजीशन, एक पोजीशन में रखते हैं हम बच्चे को कंगारू मदर केयर में या कैंगरू मदर केयर में, तो वो क्या होती है? एनी रैंडम केसेस, मतलब व्हाट इज कैंगरू पोजीशनिंग? बच्चे को कैसे रखना चाहिए? सीधा रखना चाहिए, उल्टा रखना चाहिए, गर्दन एक तरफ रखनी चाहिए, कैसे रखना चाहिए बच्चे को? वेरी गुड, वेरी गुड. द फर्स्ट इंपॉर्टेंट पॉइंट, वेरी इंपॉर्टेंट, वी नीड टू नोट इट डाउन. स्किन टू स्किन कॉन्टैक्ट between mother and the neonate. Okay, I'll repeat again. Skin to skin contact between mother and the neonate in the vertical position. You can see this picture very, very perfectly. The baby is little kind of in a semi reclining or little vertical position, and the baby, baby should be between the mother's breast. Baby should be between the mother's breast. Yes or no? Are you understanding? Very good, very good. So this is the first point. Skin to skin contact should be there between the mother and the neonate. The neonate should be in vertical position, and what do you call? They should be what do you call? क्या कहते हैं उसको? The baby should be between the mother's breast. Mother's breast. Okay, very good. Yeah, Suman is answering so nicely, and yes, Raval Singh also wonderful. Next question. Semi-reclining position. I told you. Why? Any idea? Okay, I'll give you a chocolate if anyone can by mistake answer this question. Why should I keep the baby in semi-reclining? बिल्कुल सीधा क्यों नहीं, बिल्कुल लेटा के भी दूध पिला सकते हैं. सेमी रिक्लाइनिंग ही क्यों हमें बेटर पोजीशन है? माँ तो बच्चे को लेट के भी दूध पिला सकती है, सेमी रिक्लाइनिंग ही क्यों? आई गिव यू 10 seconds टू थिंक. प्लीज पुट आंसर इन द कमेंट सेक्शन. क्यों सेमी रिक्लाइनिंग, क्या जरूरत क्या है इसकी? सिमरन, व्हाट इज योर डाउट? प्लीज आस्क अगेन. थैंक यू. Yes, very good. So Suman only is answering to prevent the gastric reflux. To prevent the gastric reflux, देखो बच्चे को gastric reflux हो जाता है. ये exam question. These are practical clinical examiner questions which an examiner ask you. If you tell the examiner sir बच्चे को हम semi reclining position में रखते हैं और mother के breast के बीच में रखते हैं. क्यों रखते हैं आप semi reclining में? क्योंकि सर बच्चे को gastric reflux जो एक common चीज होती है वो prevent हो जाता है उससे. ठीक है. Next important point. Until what time should I do KMC? Any idea? मतलब कितने टाइम तक हमको KMC करना चाहिए? मतलब खाली आधे घंटे के लिए करना चाहिए, 1 घंटे के लिए करना चाहिए, पूरा दिन करना चाहिए? So what is the answer for this question? Until what time I should do KMC? What do you think? So Simran, any idea? Jyoti, Swati, Jyoti, yes, very good, perfect. So usually, like till what time we do? Actually, the 24 hours per day, pura din, 24 hours per day, the mother should be doing a kangaroo mother care position करना चाहिए. और अगर per sitting की बात करें, 1 to 2 hour per sitting, 1 to 2 hour per sitting. Okay, 24 hours per day she has to do, and 1 to 2 hours per sitting she should do the kangaroo mother care. 1 to 2 hours per sitting, और वैसे 24 hours. ठीक है. Yes, very good. Yeah, Himanshu is right, Raval is right, Pratibha, Sapna, Jyoti, Shashank and Sucheta. Perfect, beautiful answer. ठीक है. तो हम क्या पढ़ रहे हैं? What are we studying today? Kangaroo mother care. Number 1. Number 2, हमने क्या पढ़ा? किस बच्चों के लिए होता है? लो बर्थ वेट बेबीज के लिए होता है, प्रीटर्म के लिए होता है. नंबर 3, ये क्या करें, कब तक कराते हैं? 24 आवर्स पर डे करना होता है कैंगरू मदर केयर. एंड पर सिटिंग की बात करें तो 1 to 2 hours पर सिटिंग, 1 to 2 hours per sitting. And then of course, like like the question I asked you was until what time I should do KMC. like तब तक usually करना चाहिए until the neonates no longer tolerates, until the neonates no longer tolerates. अब ये भी बताइए मुझे आप, कैसे पता चलेगा कि बच्चा टॉलरेट नहीं कर पा रहा कैंगरू मदर केयर को? how will you answer this question that a neonate is no longer tolerating the kangaroo mother care? How will the mother get to know? कैसे पता मदर को कि वो बच्चा टॉलरेट नहीं कर रहा kangaroo mother care? What will you answer? Anyone? I'll wait for 10 seconds. Any idea? Who will tell me? कैसे पता कि बच्चा जो है टॉलरेट नहीं कर पा रहा? हमारे मदर की कैंगरू मदर केयर को. Yes, very good, perfect. So always remember the baby will start having sweating. The baby will start having sweating or refusal to stay in the kangaroo mother care. Okay, बच्चा खुद ही mother को बता देगा कि he is not able to tolerate the kangaroo mother care, so he'll start sweating or he'll start refusing to stay in the kangaroo mother care position. Very good. Coming to the components of KMC, the components like most importantly, this is a very important exam question now. Which is the best weight to start the KMC? कौन बताएगा इसको? हाथ खड़ा करिए अपना. Which is the best weight? वजन कौन से बच्चों को हमें शुरू करना चाहिए कैंगरू मदर केयर? Any idea? Which babies should we start the kangaroo mother care? मतलब for example, a baby is 1 kg. Can I start kangaroo mother care in 1 kg? The baby is 1.2 kg. Can I start? Is it allowed to start kangaroo mother care in 1 kg or 1.2 kg, 1.5 kg? Any random guesses? Anyone? Which is the best weight? किस वजन पे मतलब स्टार्ट करना चाहिए? ये तो पता होगा कि 2.5 kg से कम बच्चों में करते हैं. But which is the best what do you call them? Wait, the answer for this question will be, please remember this chart I'll show. So remember the best answer for this question is 1800 grams. The best answer for this question is 1800 grams. Please remember. जो बच्चा 1.8 kg का होता है वो तो बेस्ट वेट होता है. आइडियल वेट की बात करूं मैं स्टार्ट करने के लिए कैंगरू मदर केयर को. ऐसा क्यों सर अगर 1.7 का होगा, 1.6 का होगा, 1.5 केजी का होगा या 1 केजी का होगा, ये बच्चे भी तो छोटे होते हैं. इन बच्चों को भी तो मतलब व्हाट यू कॉल्ड चाहिए होता है, क्या कहते हैं उसको, कैंगरू मदर केयर. सो if the baby is less than 1.8 plus hemodynamically stable, अगर बच्चा hemodynamically stable है, अगर बच्चा less than 1 kg है और वो hemodynamically stable है, तब you can start the kangaroo mother care in less than 1.8 also. Otherwise 1.8 is the best answer. Are you understanding? 1.8 will be the best answer. Okay, and the baby is less than 1.8 but hemodynamically stable, then also you can start the kangaroo mother care. Are you understanding? Yes or no? Please remember this word is very important. Next, when can I stop KMC? अब इतना तो समझ में आ गया 1.8 kg पे हम स्टार्ट करते हैं. स्टॉप कब करना है? बच्चा जब कितने kg का हो जाएगा then I should start. Any idea? When should I stop the kangaroo mother care? Okay, we have so many students are answering. We have Himanshu, Anjana, Bhagyalakshmi, Anusha, Mahendra, Jitendra, and Thakur, Simran, Sapna, Rahul, Pratibha, Riya, Jitendra, Laiko, Mushka. Okay, and Ramandeep Kaur Gotra. Okay, so please tell me कब तक करानी है KMC? Again, it's a interactive discussion session. ऐसा नहीं कि मैं ही से पढ़ाता रहूंगा, आप भी डिस्कस करिए. हमने ये पढ़ा कि 1.8 kg से स्टार्ट करना चाहिए बच्चे का कैंगरू मदर केयर. अगर लेस देन 1.8 है प्लस हीमोडायनेमिकली स्टेबल है तब भी स्टार्ट कर सकते हैं. अब सवाल ये आता है कब तक देना है. यस, सो वी हैव हु इज आंसरिंग द बेस्ट. द फर्स्ट आंसर इज गिवन बाय महेंद्र. वेरी गुड महेंद्र. टिल द बेबी इज 2.5 kg. जब बच्चा 2.5 का हो जाए या फिर टर्म जेस्टेशन को ऑलमोस्ट कवर कर ले. ठीक है, when the baby is 2.5 kg, that is the time I should stop the kangaroo mother care. That's another exam question. We have covered around 7-8 questions already. ठीक है. Okay. Next, duration of providing KMC. I told you for duration of providing KMC, duration 1 to 2 hours per sitting हम करते हैं और usually 24 hours per day. पूरा दिन मदर को कराना चाहिए कैंगरू मदर केयर. ठीक है. Very good. We have wonderful students answering. Riya is answering and Sushma Rani is answering. Giriraj, Shashank, Jitendra and Rahul Sen. Perfect. Very good. ठीक है. This is a wonderful chart. This is a wonderful chart from AIMS, which tells that कब तक बच्चे को हमें कराना चाहिए. Please look at this chart properly. If the baby is more than 1.8 kg, baby is more than 1.8 kg or 1800 grams cross करता है, that baby is usually stable at birth. That baby is usually stable at birth. And in those babies, you start immediately kangaroo mother care. Okay, kangaroo mother care. Okay, and of course, if you talk about what you call, if you talk about less than, like if you talk about less than 1.2 or 1.2 to 1.8, बस एक ही लाइन याद रखनी, if they are hemodynamically stable then we can start the kangaroo mother care. ठीक है, समझ में आ गया. ठीक है, वेरी गुड जितेंद्र सिंह, हिमांशु, वेरी गुड. ठीक है, अच्छा टॉपिक खत्म करना है. इसमें क्वेश्चंस आए हुए हमारे पास 8 to 10. ठीक है. Okay, Jitendra Singh is asking the ideal time. So, Dr. Jitendra, the ideal time is, that's what I told you, like 1.8 kg is the ideal weight, and ideal time like 1 to 2 hours per sitting. हर सिटिंग कम से कम 1 से 2 घंटे की होनी चाहिए, और 24 घंटे कराना है बच्चे को, what you called मदर को कैंगरू मदर केयर. ठीक है, डन. This is again another very important picture which shows the mother is having what you call, she's doing a kangaroo mother care in the baby. We can see this, the baby is there on the mother's chest between the breast. And a very important question I would like to ask here, can only mother gives kangaroo mother care? सिर्फ माँ ही करा सकती है बच्चे को कैंगरू मदर केयर, या आगे कोई और भी करा सकता है? Okay, Sharon is asking hemodynamically stable means. Sharon, hemodynamically stable मतलब कि बच्चा अपना टेम्परेचर खुद मेंटेन कर रहा है, बच्चे का हार्ट रेट, बच्चे का रेस्पिरेटरी रेट, बच्चे का सैचुरेशन नॉर्मल है. मुझे बच्चे को कोई अलग से ऑक्सीजन या वेंटिलेशन देने की जरूरत नहीं पड़ रही. अब जो बच्चा वेंटिलेटर पे होगा वो तो नहीं मदर करवा सकती कंगारू मदर केयर, राइट? तो हीमोडायनेमिकली स्टेबल मींस उसका हार्ट रेट, उसका रेस्पिरेटरी रेट, उसका सैचुरेशन, बच्चा कोई एडिशनल वेंटिलेशन पे नहीं है, बच्चा खुद से मेंटेन कर रहा है. ठीक है, हाँ. ओके, yeah, very good. So we have Giriraj, we have Gargi, Vishal, Priya, Kanika, Sucheta, Ruchika, Mahendra, and L- Linda. Okay. So yes. So my question was, can only mother give the kangaroo mother care? The answer is no, sir. Even the father also can give. Anyone, you, me, anyone, our auntie, chachi, mami, anyone can give kangaroo mother care. ऐसा नहीं है कि only and only father will give the kangaroo mother care. Anyone can give the kangaroo mother care. Okay. And kangaroo position, I've already told you, the neonate should be placed between the mother's breast. ठीक है, बोल के पढ़िए, बोलो मेरे साथ. The neonate should be placed between the mother's breast. Number one. Number two, head to one side with slightly extended neck. Okay, head to one side with slightly extended neck. अब ये कौन बताएगा ऐसे क्यों करते हैं? Why are we doing it? क्यों head at one side है और slightly extended neck है? ऐसा क्यों? गर्दन क्यों थोड़ी स्लाइटली एक्सटेंडेड होनी चाहिए, ऐसी होनी चाहिए? एवरीथिंग हैज अ रैशनल. हु विल टेल मी why the baby's head is extended little and turned to one side? Any random guesses? Yes, very good. Swati, Jyoti, Simran, Sapna Gupta, Harjinder Singh. So the neck is slightly extended so that of course, like because number one, बच्चे का airway open रहेगा, बच्चे का airway open रहेगा तो थोड़ा slightly extended होगा. प्लस वन साइड पे क्यों है? क्योंकि मदर से आई टू आई कांटेक्ट, मदर से आई टू आई कांटेक्ट जो है बच्चा बना के रखेगा. ठीक है, एयरवे ओपन रहेगा बच्चे का और मदर से आई टू आई कांटेक्ट बना के रखेगा, इसलिए द हेड इज टर्न टू वन साइड एंड स्लाइटली एक्सटेंडेड नेक. ठीक है, समझ में आ गया? सो आई रिपीट अगेन, हमने क्या किया कंगारू पोजिशनिंग में? क्या किया हमने? मदर को, द न्यूनेट शुड बी बिटवीन द मदर्स ब्रेस्ट, head is turned to one side and slightly extended neck, and very important, arms and hips are abducted and like in a frog position. This picture tells everything that the baby is in frog position. Arms and hips abducted and hips are like in a frog position. ठीक है, frog की तरह होते हैं. ठीक है, very good, very good. बड़े अच्छे से पढ़ रहे हैं सारे लोग, अच्छा लग रहा है मुझे. ठीक है. Okay, one more important point of kangaroo positioning is that baby's abdomen should be at the level of mother's epigastrium. This is a very important point. Now, who will tell me ऐसा हम क्यों करते हैं? Baby, इन्होंने लिखा है कि kangaroo positioning में baby's abdomen should be at the level of mother's epigastrium. So any idea of why do we do that? Any random guesses? Okay, Suman says, can COVID positive mother can give kangaroo mother care? Suman, yes, a COVID positive mother can breastfeed. A COVID positive mother can give kangaroo mother care. She can do anything. It's just that she has to, have the universal precautions, maintain hygiene, wear mask, always clean the nipple before and after feeding the baby, and these are precautions she can do it. Yes, Kanika Adhikari is very right. Okay. Okay, Sonali has a question that till when the mother should breastfeed her child. The Sonali exclusive breastfeeding we do till 6 months of life, and the book says till 2 years. Till 2 years, a mother should breastfeed her baby followed by complementary feeding. Okay, are you understanding? She should breastfeed after 6 months also, but only and only breastfeed will not be helpful. So after 6 months of life till 2 years, mother should breastfeed her child with the what do you call the complementary feeding, the other foods. I mean, okay. So yes, and coming back to this question, why baby's abdomen should be at the level of mother's epigastrium? A very important this one. See, mother's epigastrium. Okay, this is a very important point. Now listen, baby's abdomen should be at the level of mother's epigastrium because mother's breathing stimulates the baby and thus reduces the chances of apnea. Okay, mother's breathing, it basically stimulates the baby. The mother's breathing stimulates the baby. Okay, and of course that reduces the chance of apnea. That is the reason you keep the babies on the mother's epigastrium. Baby's abdomen should be at the level of what do you call it, mother's epigastrium. Okay, we have other people who are asking other doubt. Vandana is asking, please explain about HIV mother. Can she do breastfeed or not? Please remember active untreated tuberculosis and active HIV. If the mother is having active untreated tuberculosis or the mother is having active HIV, she can breastfeed. She should breastfeed. It is not a absolute contraindication for breastfeeding. If it is if we are sitting in London and having a conference, then yes, it is an absolute contraindication. In the developed countries, mother having HIV, mother having TB, these all are absolute contraindication in developed countries. Whereas in developing, see, India is a developing country. Okay, so what happens, like babies are dying because of lack of breastfeeding are much more than the babies dying because of mother was having TB, then baby got TB because of mother and baby died of TB. ऐसे चांसेस बहुत कम होते हैं, माँ माँ बच्चे के दूध के बिना मर जाए, वो बहुत ज्यादा कॉमन है, बहुत ज्यादा कॉमन है. Are you understanding? Mothers dying, babies dying because of lack of breastfeeding are much more than the baby dying because mother was having TB, then baby got TB and baby died of TB. That is why it is not mothers having TB, mother having active HIV. These are not absolute contraindications for breastfeeding. Please understand this. Okay? समझ में आ गया नहीं आ गया? अच्छा, अगला सवाल क्या है? हाँ, ओके, बस अभी इतना ही करते हैं, मैं आगे पहले पढ़ा लूँ. लेट्स कंक्लूड द व्हाट यू कॉल्ड स्लाइड. ओके, एंड द kangaroo positioning support the baby's bottom with a sling or a blender. You support the baby's bottom with a sling or a blender. That is you should know. ठीक है? Okay. Can the mother continue kangaroo mother care while sleep or resting? इस टॉपिक को पहले खत्म करते हैं. ठीक है, हिमांशु एंड सिमरन, लेट्स फिनिश दिस टॉपिक फर्स्ट, क्योंकि ये टॉपिक ब्रेक हो जाएगा ना, तो ये टॉपिक हम कवर कर नहीं पाएंगे. ये टॉपिक खत्म होते ही फिर आपके जो डाउट हैं, डेफिनेटली आई टेल यू द एब्सोल्यूट कंट्राइंडिकेशन एंड रिलेटेड कंट्राइंडिकेशन. नो प्रॉब्लम, पर पहले इस टॉपिक को खत्म करते हैं. ठीक है सिमरन, आर यू ओके विद दिस? ओके, परफेक्ट. हिमांशु, okay, thank you so much. So for the question of this round now is that, can the mother continue kangaroo mother care while sleep or resting? So what do you think? If she's resting or sleeping, can she or should she continue kangaroo mother care? Yes or no? Any idea? So yes, Anusha says yes. Rahul, Rekha, okay, says yes. Himanshu, okay. Alina, okay, okay. Very nice. Yeah, perfect. So we have wonderful students who are answering. So please remember, yes, she can what you called breastfeed her child. So yes, she can. What do you call it? The mother is having, she's sleeping or taking rest. She can give kangaroo mother care, and she can do that in the reclining or semi-recumbent position. She can do that in the reclining or semi-recumbent position of around 45 degree. 45 degree. Okay, very good. So Vandana is right. Rahul, Babita, Giriraj, Sapna, and Simran. Very good. Perfect. Okay, next question. We're coming to the end of this topic. Discharge criteria. So when should I discharge this babies? Like the baby was 1.8 kg and we started kangaroo mother care. So like when should we discharge the child? Any random guesses? कब तक हमें discharge करना चाहिए? So what do you call it? Shrikant, Savi, what do you think? Okay, very good. Perfect. So please remember that if the baby is gaining weight, the discharge criteria, again a 3 marks question. What is the discharge criteria for kangaroo mother care? Number one, if the baby is gaining 15 to 20, if the baby is gaining 15 to 20 grams per kg per day of weight for 3 days. Number one, if the baby is gaining 15 to 20 gram per kg per day for 3 days, that will be, this is the first discharge criteria the baby should be having. Number three, the baby should be able to maintain the body temperature. The baby should be able to maintain its own body temperature. The baby should be able to maintain its own body temperature in room temperature for 3 days. Matlab, I don't have to keep the baby in the warmer. The baby is able to maintain his own body temperature basically for next 3 days. So क्या क्या पढ़ा हमने discharge criteria में? Number one, the baby should have a, anyone बोल के पढ़ो, the baby should have a weight gain of 15 to 20 gram per kg per day. Number two, the baby should have a maintain its own body temperature for 3 days, right? Number three, the baby is feeding well. The baby is feeding well. Number three and number four, mother and family are confident to take care of the baby. Mother and family are confident to take care of the baby. Yeah, very good, Srikant, Poonam, Simali, Nurbanu, Alina, and Anusha and Himanshu. वेरी गुड परफेक्ट परफेक्ट ठीक है बहुत अच्छा से पढ़ रहे हो ऐसे ही पढ़ना है दिल से पढ़ना है ठीक है मन लगा के पढ़ना है और ऐसे पढ़ना है कि हम पहली और आखिरी बार ये टॉपिक पढ़ रहे हैं ठीक है इसको रिवाइज नहीं करना बस हो गया ये पहली और आखिरी बार लाइफ में पढ़ा था और अब सब कुछ हमारे दिमाग में है नोट्स में कम रखो दिमाग के अंदर ज्यादा रखो हम किताब बंद हो जाती है तो दिमाग भी बंद हो जाता है ऐसा नहीं होना चाहिए कॉपी बंद करके पूछूं तो कुछ नहीं याद रहने वाला है ऐसा नहीं होना चाहिए like you're writing in the notebook but once I close the notebook you should be able to tell me without opening the notebook also ठीक है okay yeah, post, huh, okay. So, again, last question, then this topic is over. Post-discharge follow-up. Post-discharge follow-up. अब बच्चा 1.8 kg का था मैंने कैंगरू मदर केयर चालू किया बच्चा 2.5 kg का हो गया और अब बच्चे की मैं छुट्टी कर रहा हूँ बच्चा का वेट गेन हो रहा है बच्चा टेम्परेचर मेंटेन कर रहा है और मदर इज वेरी कॉन्फिडेंट ऑल्सो हाउ टू टेक केयर ऑफ द बेबी बच्चे को मैंने घर भेज दिया अब पोस्ट डिस्चार्ज फॉलो अप अब बताएं मुझे बच्चे को कब कब बुलाना है आप अगर आप ट्रीटिंग डॉक्टर हैं तो आप कब कब बुलाएंगे बच्चे को मतलब मैं रोज बुलाऊं बच्चे को मैं हफ्ते में एक बार बुलाऊं या हफ्ते में 3 बार बुलाऊं एनी रैंडम गेसेस एनी रैंडम गेसेस yes Simali has given a very beautiful what do you call answer yes Simali very right okay yes Hmm. So, post discharge follow up number one once अब जब बच्चे को छुट्टी कर दिया द बेबी इज 2.5 kg और द बेबी हैज रीच टर्म जेस्टेशन और बेबी को मैंने केएमसी बंद करके मैंने उसको डिस्चार्ज कर दिया राइट डिस्चार्ज करने के बाद अब कब कब बुलाना है हमको पॉइंट नंबर वन वंस और ट्वाइस अ वीक once or twice a week till the baby reaches 37 to 40 weeks of life ठीक है आई रिपीट अगेन लाइक 37 टू 40 वीक्स ऑफ जेस्टेशन मतलब मान के चलो समझ गए ना सो आई रिपीट अगेन कब कब बच्चे को बुलाना है वंस और ट्वाइस अ वीक जब तक बच्चा 37 टू 40 वीक्स का एक प्रॉपर बेबी ना हो जाए तब तक हम बच्चे को हफ्ते में 2 दिन बुलाएंगे नंबर वन नंबर टू यस अगर हम वजन की बात करें तो टिल ही रीचेस 2.5 टू 3 केजी देखो 2.5 केजी का बच्चा जब हो गया था तो मैंने केएमसी बंद कर दी थी मैंने बेबी को डिस्चार्ज कर दिया था अब मैं उसको वंस और ट्वाइस वीकली बुलाऊंगा वंस और ट्वाइस वीकली आई विल कॉल टिल द बेबी अटेन्स 3 kg जब तक बच्चा 3 किलो का नहीं हो जाता और जब तक बच्चा 37 टू 40 वीक्स को पूरा प्रॉपर टच नहीं कर देता तब तक मैं बच्चे को हफ्ते में 1 या 2 दिन बुलाऊंगा वेरी इंपॉर्टेंट ओके नेक्स्ट उसके बाद सर क्या करना है देन वंस इन 2 to 4 वीक्स मतलब यूं समझे कि मतलब 4 हफ्ते मतलब 1 महीना होता है तो 1 महीने में एक बार आप आइए बच्चे को टिल 3 मंथ्स ऑफ लाइफ 1 महीने में एक बार आना टिल 3 मंथ्स ऑफ लाइफ एंड देन वन इन 2 मंथ्स देन वंस इन 1 to 2 months टिल 1 year ऑफ लाइफ ठीक है मतलब समझ में आ गया ना पहले हमने कब बुलाया 2.5 केजी का बच्चा था छुट्टी कर दी उसकी कब बुलाना है उसको एक तो बुलाना तब तक है जब तक 3 केजी का ना हो जाए और बुलाना तब तक है जब तक वो 40 वीक्स का रीच कर जाए तब तक मुझे उसे वंस और ट्वाइस वीकली बुलाना है ठीक है अब वो 3 केजी का गेन कर गया अब भी बुलाना है उसे हर हफ्ते नहीं अब उसको महीने में एक बार बुलाना है अब उसको महीने में एक बार बुलाना है कब तक बुलाना है अगले 3 महीने महीने में एक बार बुलाना है। उसके बाद क्या करना है? उसके बाद कुछ नहीं करना, 1 से 2 महीने पे एक बार बुलाना है टिल 1 ईयर ऑफ लाइफ, है ना? सिंपल सा है, इतना मुश्किल नहीं है। ओके, वेरी गुड, परफेक्ट। ठीक है, नाउ कमिंग टू द क्वेश्चन एंड द टॉपिक इज ओवर नाउ. So, recent question 2017. The question is, which of the following is a component of kangaroo mother care? Is it the incubator? Is it the heat therapy? Is it the exclusive breastfeeding? Or is it the phototherapy? So, what do you think? Any idea? Okay, any random guesses? Okay, yes. Who will tell me the answer? Anyone? Swati? So, Rekha, Jyoti, Alina. Any random guesses? Hmm. Yes. So, yes. Okay, so perfect. Yes, the answer is perfect. Very good. The students who have given the best answer are Himanshu, Siddhi, Rekha, Anusha, Poonam, Vishal, Himanshu, Kavita, Sushma, रमनदीप, ज्योति, श्रीकांत, कनिका, अर्चना, गिरिराज, बहुत सारे नाम हैं, बहुत सारे। बस सही जवाब दे दिया, इस बात की मुझे खुशी है। सो एक्सक्लूसिव breast feeding is the most important component of the kangaroo mother care. I'll give you a toffee if anyone can tell me. Abam, we are coming to the end of the session. When do you celebrate breastfeeding week? Breastfeeding week कब celebrate करते हैं? Breastfeeding week कब celebrate करते हैं? Any idea? When do you celebrate breastfeeding week? We have Sushma, Mahesh, Rahul who are answering. Anusha, okay. Yes, when do you celebrate breastfeeding week? कब celebrate करते हैं? Okay, so students who are answering are Ramandeep, yes, Anusha. Anusha says August. So Anusha पूरा August? कौन सा August? मेरा बर्थडे, मेरा मेरे पापा का बर्थडे गया अभी, तो मेरा तो 11th मार्च को आता है, तो पूरा अगस्त में करते हैं, कब करते हैं? Yes, the student who has given the best answer is Himanshu and Sharon, the first one who has answered. First week of August. First week of August, we celebrate the what do you call breastfeeding week. First week of August, we celebrate breastfeeding week. When do you celebrate Doctor's Day? Any idea? When do you celebrate Doctor's Day? कब करते हैं celebrate? जल्दी बताओ. When do you celebrate Doctor's Day? कौन बताएगा? So when do you celebrate Doctor's Day? Any idea? Let's see who answers. So, okay, the students who are answering are Firoz, Pinky, Neha, Subrato, Ajit, Rakesh, Deepak, Sunil. So when do you celebrate Doctor's Day? Okay, the best answer again, our one of our favorite juniors. His name is Sunil Chehar. So Sunil, yes, Sunil has given the best answer. 1st July. 1st July we celebrate Doctor's Day. So Doctor's Day we celebrate on 1st July. Breastfeeding week on first week of August. Okay, okay. Next one. Which of the following is not a component of kangaroo mother care? Which of the following is not a component of kangaroo mother care? The options are skin to skin contact, supplementary nutrition, exclusive feeding, or early discharge and follow up. So what do you think? Which is not a component? It is not a component. The students who are answering these questions are Sushma, Simali, Pratibha, Manisha, Simran, Sunil Chehar, Sharon. Yes. So the one who has given the best answer again, Sharon. Sharon is answering all the time. Good, good. बाकी सब तो कर ही रहे हैं. Okay, बहुत सारे नाम हैं. कहाँ से शुरू करूँ मैं? ज्योति, अंजना, अंतरा, श्रीकांत, गिरिराज, शानू, कीर्ति, रेखा, हिमांशु, ज्योति, बहुत सारे. परफेक्ट. बस आंसर बिल्कुल सही है, उस पे हम फोकस करते हैं, नाम तो बहुत ही सारे हैं. So the answer is the supplementary nutrition is not a component. Supplementary nutrition, it is not a component of kangaroo mother care. Early discharge और follow up होता है, feeding अच्छा कराते हैं, skin to skin कम करते हैं, but supplementary nutrition नहीं, वो kangaroo mother care का जो है component नहीं है. ठीक है, ये हो गया. ठीक है. This new students, my mobile number is 9999897081. This is my mobile number for my free WhatsApp and Telegram group. Who students who are live can message me on this number, and I will add you in the what do you call respective WhatsApp and Telegram groups. And last motivating quote of this day is, "He who does not hope, he who does not hope has already lost. He who does not hope has already lost." This is the beautiful last motivation quote of the day. So, he who does not hope has already lost. So we have to have hope in life. You have to hope that everything will be fine. You have to hope that so much you're studying will make sense by the end of the day. You have to hope that everything will be okay. You have to hope that whatever you're studying, so much you're studying, so much struggle and sangharsh you're doing in life, it will make sense one day. You have to hope this. You have to hope. उम्मीद पे ही दुनिया कायम है. वो कहते हैं ना, बूंद से ही सागर बनता है. सो बूंद बूंद से आप होप करिए और सागर अपने आप बन जाएगा. सो he who does not hope has already lost. This is the motivating quote for the day. Thank you so much for the participation. Thank you so much and have a wonderful day ahead. And अब मिलते हैं अगले हफ्ते एक नई टॉपिक के साथ, एक नए मोटिवेटिंग कोट के साथ. तब तक के लिए थैंक यू. बाय बाय. I will go and have breakfast. Please, you should also have breakfast. I'm having aloo parathas today. Let me know in the WhatsApp what are you having for breakfast. Thank you so much and bye bye.